Audience, I do want to, first of all, again, thank Dr. Logan for helping put this together. It was a great presentation. Thank you. We have Phyllis Johnson, Fred Seavey, and Jerry Fontaine. Please come forward. The microphones are on. Please identify yourselves for the record. You'll have up to 3 minutes for your comments.
Phyllis Johnson, representing California State Retirees, but a general question is in order. I've heard a lot about coverage after the fact. My question is, what's being done for prevention and early care in the early years to prevent mental illness from getting too far, too quick? Thank you.
Thank you. You're on.
Okay, Jerry Fontaine, Chief Financial Officer of the California State Retirees. I believe I heard a statement, and if I'm wrong, please correct me, that if a person seeks help through a practitioner and cannot get one in-network, and they have to go to an out-network, the out-network provider is paid at the in-network price. I was wondering if there's anything that the organizations do to mitigate that extra expense that the individual would receive that may contribute to their mental condition, or would force them to not seek help because they can't afford the difference between in-care and in-provider and out-provider. Thank you.
Thank you. We'll make sure that we get those answers for you, and we'll have them for our next meeting.
I appreciate that.
Thank you.
Hi, Fred Seavey with the National Union of Healthcare Workers. We're a union of 15,000 caregivers in California, including 4,000 mental health therapists who practice in the private sector. We're the largest union of private sector mental health therapists in the state. First of all, we want to thank the committee for its focus on mental health. We think it's extremely important. As others have referenced, public health data indicate the growing incidence of mental illness and substance use disorders across the U.S. And just as an example, the CDC recently released reports, and suicide is now one of the top 10 leading causes of death in the U.S. And among adolescents between age 14 and 17, suicide is the leading cause of death. So these are not only illnesses that are on the rise in our society, but they're life-threatening illnesses oftentimes. So again, want to thank the committee. Just 3 quick comments. First, as far as the adequacy of the provider networks, we have experience because Kaiser uses both Beacon and Magellan, and we've interacted with more than 1,000 consumers and a lot of therapists. But we have lots of experience about sort of these phantom provider networks. In other words, lists of providers that are on paper, but when patients seek to actually access them, they have huge difficulties, and they'll call through dozens and dozens of therapists trying to get care. I had one patient, she phoned through 100 therapists. This is following a suicide attempt and couldn't access care. Another who was diagnosed with depression and referred out to Beacon or Magellan made 92 calls over 5 months, again, without any care. And the plan did not track the waits and had no indication that this patient never received any care whatsoever. I think also it's many of these patients, imagine they're functionally compromised with the conditions that they have, but imagine having depression where you have difficulty getting out of bed every morning and then being asked to phone through not just 5, but it could be 20 or 40 therapists to try to get care and await their return calls and emails. It's just not appropriate care. And what we find is each time you erect an obstacle in front of a patient that they have to leap over or crawl through to access care, you'll find a certain percentage of the patient population drops out. And they throw up their arms and walk away without care. They may cycle downwards into crises or try to pay out of pocket for their own care. Secondly, in terms of the workforce shortage, there was lots of discussion here today. I wanted to point the committee to a report that was issued by the California Legislative Analyst's Office in May of 2019, where they described mixed evidence of a workforce shortage. They said, yes, there are shortages among therapists in rural areas and the Inland Empire, but the rest of the state has adequate therapists. I think that in our experience, the fundamental problem here, someone mentioned it earlier, it's a supply and demand question, but it has to do with the reimbursement rates. And many of these external therapists report to us that their rates have not risen in many, many years and are inadequate, and that they can receive much more from cash-paying patients So when they get the call from a patient referred by Beacon, Magellan, et cetera, they'll say their panel is full, and they won't take those patients because simply the reimbursement rate is too low. Thank you very much.
Thank you. All right, brings us to agenda item 6B, summary of committee direction. Mr. Olds.
Sure. Let me. So I've got 5 items to report back on. The first was the item that Mr. Rubalcava mentioned, and the question was whether the PERS Select app can identify women eligible for the Future Moms program and the co-insurance reduction, or whether there's any possibility of using that to do an earlier identification. We will look at that and get back to you. Second was from Mr. Jones, and that was just a request for a general update at a future board meeting on the progress on some of the key areas where there was widespread acknowledgement by the folks presenting today that we're in need of progress. I would add to that the average wait times that Mr. Perez mentioned. I can just sort of roll that into that general report. So we will report back to you at a future meeting on those items. Third, of the new mental health providers nationally, what % are located in California? Fourth, what is the cash rate? This was Ms. Alvarez's question. What is the cash rate for mental health providers reimbursement by MSA? And then the last one was the in cases where a member identifies a provider who is out of network as the available provider, is that provider reimbursed only in network rates? It's actually more complicated than that, but we will, rather than get into it now, we can report back along with these other items to the board.
I think more of the question was, is the member paying a higher fee than otherwise if it's out of network? So,
yeah.
Great, thank you. Next is item 6C. I have 2 requests from the public to speak, Larry Woodson and Tim Behrens. Please come forward. You'll have up to 3 minutes for your comments. And the microphones are on.
Go ahead. I was going to defer to seniority.
He wants to be last.
Larry Woodson, California State Retirees. Thank you for the opportunity to comment, Chairman Fechner and board members. I want to comment on some news that was just breaking today or maybe late yesterday. The House of Representatives leadership has reached a bipartisan agreement, which is a rare commodity these days, on a budget bill with some accompanying provisions that would be very beneficial to us at CalPERS with health plans, and specifically permanent cancellation of the Cadillac tax, the HIP tax, and tax on medical devices. And also the White House apparently has been in the loop on this and is supportive. So if it comes to pass, I would urge CalPERS to bring United Healthcare back to the table, renegotiate the contract with them because they used the HIP tax to justify the large premium increases for 2020. Other carriers may have also used the same justification. So this is kind of an early heads up, but CSR, if it does pass, will be back asking the same thing more formally. Secondly, I'd like to comment on the Santa Barbara contract, Anthem contract impasses that I just heard about for the first time. And I talked to some of my colleagues here, and they hadn't heard either. And it seems very late in the game to be telling us about this, but I think Dr. Moles mentioned that I'm assuming it would apply in 2020. And he clarified that it's just for PPO, Anthem PPO, not HMO plans, but I don't think he specified if it's that the supplemental Medicare plans are not included. Is it just the basic plans? And that was the case before with other breakdowns. And then I've been doing this for 4 years, and this last year it's become way too common for Anthem to have hospital contract negotiations break down at the last minute and not be able to reach them. And so I appreciate the need to control hospital costs. CalPERS itself has a big say in this. It's not just Anthem on these self-funded plans. You set the guidance that they follow. And so the last thing is I'd like to request a copy of the letter that was sent to members. I'd appreciate that. Thank you for your time.
Thank you.
Just one clarification. Anthem traditional HMO, correct? Or is it select HMO? One of the Anthem HMOs would be implicated here.
Right, but it's the PPO supplements that I'm asking about.
And I thank you. Rob Honecker, Anthem Blue Cross.
There you go.
Yeah, thank you. I just thought I'd address the Medicare supplement. It will have no implication on that. We will supplement the benefits based on the Medicare reimbursement, so your members won't be impacted on Medicare supplement.
That's what I thought, but I wanted to make sure. Thank you.
Thank you. Mr. Burns.
Thank you, Chairman Fechner, members of the committee, members of the board. Tim Behrens, President of the California State Retirees. A great second shot at mental health this morning. I appreciate it. I think there may be an untapped resource in California that the different providers can look at, and that's something called a licensed psychiatric technician. That's a state employee classification now. And 13 years ago when I left state service at an institution, psych techs were going into the community and into public and corrections and other jail systems and evaluating mental health issues and mental health possibilities for inclusion into the state system. I think this may be something that they could look at that would help them with their intake of patients and maybe cut down on the phone calls that have to be made repeatedly, and at least become part of the system that could redirect them. I know when CalPERS changed their system in the healthcare here, when we call in, we give our membership two instructions. If you're on Medicare, tell them right away so they can direct you to the correct staff. If you're not, tell them right away and they can direct you to the same staff. I'm hoping in the mental health system that could be just as easy as that. You know, if you know what the issue is, you can direct them to somebody and they won't have to wait, or as Mr. Rufino pointed out, bad things happen. The other thing I wanted to do is acknowledge Donna Lum. For her 21 years of service. She has provided outstanding service to the stakeholders of the California State Retirees. She's been instrumental in enhancing the communication system between CalPERS and the stakeholders. And Donna, as promised, I brought you an application to join the California State Retirees.
Very good. Thank you. Seeing no other requests to speak, everyone have a great holiday season. This meeting is adjourned.